Hi, my name is Ashley Cook, and I chose the pathogen known as the Ebola virus, Ebola virus. The reason that I chose it is because I have always been very interested in diseases that are super virulent and deadly, and so that was the reason that I chose Ebola out of our options for this semester. Rundown of all of the segments of this presentation about Ebola. So, what is Ebola? The diagnosis, how is Ebola diagnosed, symptoms, how does Ebola affect the human body, treatment, about antivirals and convalescent serum and other options for treatment, prevention, and what happens after you've had Ebola. Ebola was discovered in 1976 by Dr. Jean-Jacques Muyembe and Dr. Peter Piot. The way that it was discovered by Dr. Muyembe is a nun came down with Ebola virus and he flew her to another country because they were in a very remote area that did not have the capabilities for testing or finding out what was wrong with her, so they flew to another country, and that was the nod to the flying nun. This virus itself, this is the pathogen known as Zaire Ebola virus or Ortho Ebola virus variants. They are used interchangeably in literature. The genus is the Ortho Ebola virus, and the family is the Filoviridae, which means thread-like, and that is based on the appearance. Here is a schematic representation of the genome organization of the Ebola virus and a linear view of the glycoproteins. It is made up of several proteins and is a single-stranded RNA virus. As of 2022, about 15,409 people had died from Ebola virus. However, there was another outbreak in the fall of 2025, and another additional 45 people succumbed to the virus. It was in an area that did not have very good access to medical care and had an approximate death rate of 70.8%, which was rather high considering some of the treatment options that are available now. Of those 15,000 that died, the greatest portion of people died in 2014, which was when the most serious outbreak of Ebola occurred. At that point, about 11,000 people of the 15,000 died. And here is some of the hysteria from our current president, who was not our president at that time. He was a private citizen, celebrity figure at that point.
Donald Trump is
And this
calling
is a
for a
variety of the
complete
tweets
and
and
total
things that he had
shutdown of
published
Ebola virus
surrounding
disease
Ebola. And I
entering the
made
United
this
States
AI
of
video
America.
of what he probably would have said at that point if he had been able to say it from the White House.
Donald Trump is calling for a complete and total shutdown of Ebola virus disease entering the United States of America.
There were several other politicians, including Rand Paul at that time, who were very vocal and concerned. I would say that it was sort of reaching a level of hysteria at that point about the virus. Next, we're going to take a look at how Ebola is diagnosed, the type of tests that are used in order to diagnose it, and how it is transmitted from person to person. Obviously, it has a original zoonotic source from a fruit bat and some non-human primates. The diagnostic methods are PCR, which is a blood test. It is the most sensitive and detects the genetic materials from the virus, and it is also the one that will actually show positive at the soonest point of as possible once you've been infected with the virus. The other option is the antigen test, and that's a lot like we now use for COVID test so that we can rapidly get a result, and that is obviously better suited for places like sub-Saharan Africa where you do not have the ability to keep blood samples from coagulating and being traveling back to a lab. So the antigen tests are obviously the most useful in a place like Africa. Ebola mimics a lot of other illnesses in the initial phases of the disease, which makes it difficult to realize that someone has been infected with Ebola. And given the fact that it is quite deadly and that they can spread it is very unfortunate. Similar things are cold flus, malaria, just a variety of illnesses are similar. Ebola has two distinct phases, both dry and wet. The dry phase is the period when you have fever, headache, muscle and joint pain, fatigue, red eyes, sore throat, and hiccups. The wet phase is diarrhea and vomiting. And also there is the hemorrhagic portion, which can be bleeding from places where you may have had blood drawn, and it includes petechia, which is bleeding underneath the skin that can happen, bleeding from the gums. Essentially, places that you do not want to be bleeding from are likely to bleed during that portion. And I mentioned hiccups, and if a person develops hiccups as part of their Ebola, they usually have a very severe case. And again, the bleeding that I was talking about that can happen is a late stage symptoms of Ebola that happens usually not long before the person either finally recovers or succumbs to the illness. There were not a lot of early treatments. It was basically just supportive care, like you would treat a cold at home, and as such, the death rate was very high at 90%. There are now current treatments that are far more successful and beneficial to people that are unfortunately stricken with Ebola. In the very early stages, when we had a Samaritan's Purse physician that was infected with the disease, he was brought back here and he was actually given a treatment that at that point had only been given to monkeys. It was called ZMapp. It actually saved most of the people that were given it during that time period, and better treatments have been developed since then. Newer treatment modalities, one of the most effective being a vaccine. It's about 99.9% successful in a lab, and then in the field scenario, it's about 84% effective. Monoclonal antibodies are have a death rate of about 34.1%, which is significantly less than 90, but it is not as good as the vaccine. Those are also a little more difficult to administer. They're an IV, whereas the ring vaccination is an easier process, but they do have to be refrigerated. So how do you prevent Ebola? Fortunately, it can be prevented. Vaccines, as mentioned, are good for pre and post exposure. People can get the vaccine up to 10 days after being exposed and have had very good results doing so. The other thing is that people that work with the virus are also able to get vaccinated, so that cuts down on their likelihood of being exposed to the virus. Deadly effects. And then finally, the other thing to think about is stopping the spread, which includes not having contact with contaminated bodies from in funeral rites, and also community healers. expounding on that. So that people need to avoid contact with sick persons. Do not consume any bush meat. Seek care immediately, as the viral load being lower helps the person have a better likelihood of recovering. And then rigorous hand-eye hygiene is also very important. I just want to briefly touch on the fact that sexual intercourse is a dangerous endeavor after a person has recovered from Ebola, because it can live in seminal fluid up to actually over a year. A lady actually contracted Ebola after a man had been recovered 199 days due to the latent virus there, and it can also live in the eye in a similar fashion. And patients generally have complications, kind of like long COVID. As much as 4 years later, over 75% of people that survived Ebola do have post EVD complications. And that's a quick rundown on the Ebola virus.